All right, you feral unhinged essentials, welcome back to another episode of Cuss and Discuss. It is Friday, November 14th. We are in the middle of the cold months. Actually, at the time of this recording, it's the coldest it has been in our state in the whole year.
I love it. I
know.
love
We
it.
are in jackets. We have hoodies. We are wearing our tight pants on top of our innards and our skinnards and everything else. We are so glad that you guys have come back for another episode of Cuss and Discuss. Today, we are going to talk about something pretty interesting to most of us. So, from our military to first responders, second responders, and healthcare, you have dealt with the people of the public that are inappropriate.
Okay, so guys, just a little spoiler here. I want you to understand that we've done this recording previously and it lasted for several hours. And
I think we went just under 4.
So we are 100% re-recording this because I believe every other word out of my mouth was not a pleasant one. And I felt like we probably need to revamp this, and I needed to calm my jets a little bit. Just a little, so not a lot. Just
there are times, everybody knows that there are times when you have like the med room talk, the smoke break, the bumper time, the hey, it's just us.
Yeah.
Like, listen, I noticed something different, and you kind of peel back the bandage, and it's not just a scar; it starts bleeding.
Oh God, it was a hemorrhage. It was ugly.
Yeah, and so that's what this is. So we in our line of work, and I like, again, from military, first and second responders to healthcare, we get the whole gamut from the bottom of the barrel to the nicest, most saintly people on the planet walk in at any time. You're not allowed to prepare.
No, you walk in and
you're not allowed to get ready. And then all of a sudden it's, hey, I have this angry person. Hey, I have this unconscious person. Hey, I have this suicidal, homicidal, somebody with a bomb on, somebody that's holding a gun. It's somebody that's committed self-harm with a weapon. Anything from domestic disputes to self-harm to homicidal ideations to suicide bombers, mass shooters, everything. So the inappropriate behavior part of our job that we have to deal with, and it always seems to bookend the sweetest baby that just has a little cough, and it is like you're dealing with Gerber baby,
yeah,
with a cough, and mom and dad are nice, baby's nice. It's a very cut and dry. Here it is.
Yeah,
and then you have to deal with Sparkle Britches, who's nuck and futz. That's completely inappropriate. And then immediately after that, or while that person is still losing their shit,
yeah,
you have the 90-year-old woman that's got back pain. She's like, so sorry, I'm here. I can't get a hold of my doctor because they're on vacation, and they just told me to come to the ER. So they're doing what they were told to do.
Yeah.
And so you have this bipolar shift happening at the same time.
Yes. I think my whole issue is the inappropriate behavior when you come to an emergency department.
Yes.
What part of coming to a public area do you think in your mind that it's okay to act like a complete moron?
And by that, like screaming, cussing, pissing, shitting on yourself, throwing
or
things
in the floor,
cussing out the staff.
Where do you think that it's okay to do that? Do I 100% understand that it's a high stress area.
Mm-hmm.
I get that. There are dilemmas. I get it. I understand that. But where in your right mind do you think it's okay to come into a facility and act like that? That's my question of the day. I will never, and I don't remember when I have ever gone into Walmart or McDonald's and pissed on the floor just because I was unhappy.
What in your adult mindset makes you think that it is okay to behave that way in a hospital when you know damn well you wouldn't act that way at your own home?
Well, hell, you would get arrested anywhere else you acted like that.
Yeah, absolutely.
If I walked into Walmart and pissed on the floor, My ass is going to jail.
Yeah.
But it's okay to come into an ER and do that. No, it's not. It's not okay.
Yeah. Or vomit all over yourself and expect somebody else to clean it up. Shit
Okay.
your pants,
Okay.
expect
In
somebody else
some
to
in
clean it up.
some
Yeah.
situations, I understand.
Yeah.
Okay. Depending upon how sick you are. But guess what, people? Your legs still work when you walk in an ER.
Yeah. You made it from you whatever facility you were in, house, whatever, when your emergency started, and I say that with air quotes, you made it to the car, you drove
Yes.
to the ER, you came into the ER, you saw a wheelchair, and you went, oh, oh God, I can't do the walks anymore.
I I do not
Yeah.
understand that.
Mm-hmm.
I don't.
Yeah.
And guess what? No, I'm not going to cuff you because you're too lazy to stand up and walk to the bathroom.
Yeah.
I'm not going to do that. Your legs do still function. You still have to have some sort of independence when you leave because I'm going to say 95% of the people who check into the ER do not stay. You get to
Oh,
go
well,
home.
and that's the part of healthcare is encouraging independence.
Yes. I mean, I get that
Yeah.
as a nurse or probably any other area, you're trained to encourage independence. You want them to function on their full capacity. And if you come to me and you're having somebody take care of you at home because you're unable to do that, I will continue to do that for you.
Yeah.
But if you were wiping your ass and you got yourself in the shower today, you're going to be
Yeah.
expected to continue to do those
This
things.
this cuss and discuss is that specific stereotype.
Yes.
It's the people who were fine, decided that they weren't.
And our body parts no longer
Yeah.
function as soon
Well,
as we
and then
walk into
it's
an
the
ER.
it's the stereotypical people. I won't even go down the slang terms for them, but everybody's thinking about it right now. It's the stereotypical people that get babied the second that they say ouch or I don't feel good or anything else, and then everybody does anything for them. And then when they come to the ER, they expect country club service.
It doesn't happen. It's not a reality.
No, you are coming to a whatever bed ER that's probably already full
Yes.
and expecting VIP treatment because you said ouch or I don't like.
Mm-hmm.
Get me to a room, take care of me, do the things for me, make me feel better, do it right now. And 9 times out of 10, it's some kind of chronic issue or an issue that you fucking created for yourself.
Yeah.
And now it's somebody else's problem. It's the nurse's problem. And if the nurse doesn't do it, guess what? I get to write a complaint.
Yeah.
And it doesn't matter how many flower awards that nurse has got, that complaint goes straight to admin and they will be called in off shift from home to come and correct your behavior because you were quote unquote not polite to them. Maybe because you either asked a question or expected them to get up and use the bathroom on their own.
Or your face just wasn't the way it should be.
Yeah.
The sad thing about it is HCAPs, are they good? Sure. I'm sure they have some good, reasonable thing.
Yeah.
I get that. But patients' expectations are unrealistic
And they
because number
don't
one,
determine treatment.
they don't. Because number one, I understand that you have pain, but I have already given you pain medication. There's no guarantee I'm going to alleviate all your pain.
Well, and that's not the point either.
And
It's
as
to
a
get you
nurse,
from extreme to workable.
yes. And but even as a nurse, I don't have control of the RX station.
No.
I'm not going to be the one to give you your Dilaudid that you think you have to have.
No.
It's just not realistic, guys.
Well,
It's
in
just
the
not.
emergency world, pre-hospital and ER, it's not our job to fix your problem. We are there to mitigate the emergency only
Yes.
and then move you on to your primary care or specialty care for you to fix your problem. It's not our fault that they won't see you for 3 weeks.
Yeah, there's nothing we can do about
You
that.
also probably knew that you had this issue to begin with in the rare instance that this showed up out of nowhere. That's typically not the patient who complains and does all the things. Rarely, yes. You have the douchebags that come in that's the first time that they've had abdominal pain, a cramp, or they were unable to fart or take a shit. And, and then they want us to dig in their butthole to get everything out. But for the most part, these are the chronically sick that have, what drives me nuts personally is to figure out that they walk in with a diagnosis, typically coming from their primary care.
Yes.
And having already gotten their medications from whatever pharmacy. They take 24 hours of it and go, I'm not feeling better. Now I'm going to go to the ER and make it their problem. When I go there, I'm going to act a fucking fool.
Yeah. It's not okay. It's just not okay.
No.
My shift is already hard enough.
Well,
I don't need you in there screaming at me, acting a damn fool. I don't need that. I don't want it.
Yeah.
And honestly, if you want to get me to shut down quickly, do that.
Yeah.
Because do you think I'm going to come in your room and check on you very frequently? No, I'm not. I will come and check on you.
Yeah. As absolutely necessary as possible. Yeah.
You're going to get worse care acting like a damn fool than you would if you're just pleasant.
Yeah. What is it? You attract more bees with honey than vinegar?
Yes.
Yeah.
I mean, I do not respond well to people screaming and acting stupid.
Yeah.
I don't respond well to that. Never have, never will.
Well, and let's also be clear. We are not talking about the patients who are legitimately in a psychosis. Because you can tell from the get-go they are altered.
Yeah. I mean, you know.
Just acting a damn fool. If you come in drunk,
I have zero respect for that. Zero.
You put yourself in that position.
And that's your own damn fault.
Yeah. And now, not only did you put yourself in that position, now you've got cops and security, and you're putting staff at risk. I mean, hell, we had a patient angry, pissing, fighting off the cops, and the cops had the nerve to come in and go, "Hey, your nurses need to come get this patient out of the car." We had a shift full of female nurses that day.
Absolutely not.
That's not okay. That's not safe, and that's inappropriate. Like, how many stories are we going to have to read online of patient kicking the shit out of staff?
Oh yeah. I mean, there's been nurses injured. There's been, I mean, come on.
And then it turns into, well, what did the staff do? What did the staff do? No, they were the safe person hired to take care of patients. And they got a knuck and futz person come in there
and beat the shit out of them.
Yeah. And they're expected to just like, oh, what could you have done different? What could I have done different? Told that fucking patient to fuck off.
Well, and that's my views on it.
Yeah.
I mean, if you're going to act fucking crazy on me and threaten to whoop my ass, I ain't taking care of your ass.
Yeah.
Forget it.
Here's the thing that bothers me the most about emergency medicine. Man, I'm going to peel back a scab here. What pisses me off the most about emergency medicine is if I want to have a surgery, elective, I have to pay for it up front.
Yes.
If I need to go to surgery, typically I got to pay my deductible first.
Yes.
If I want to go get medicine prescribed by a doctor at a pharmacy, I got to pay for that.
Yeah.
If I want to see my primary care, I got to pay for that.
Yeah.
If I want to see a specialist, I got to pay for that. Hell, if I want to go get an eye exam, I got to pay for it. If I want to go to the dentist, I got to pay for it. But if I'm within 300 yards of any fucking ER, I can do whatever, however, whenever, and not expected to pay for it.
No, you can come in there, act stupid, scream at people,
and then the staff has to do everything for me. And God forbid that irate patient fill out a complaint, because guess what? That complaint's going to be more valid than the 100 compliments that I've gotten in the past.
Yeah, 100%.
And we need repeat customers. And Jesus, you're expecting to create a service on sick people, repeat customers? That pisses me off. And then you get to come in and act however you want, when in any other realm of medicine alone, any other realm, if you went in for your elective surgery, say you were getting breast implants, but you were drunk and acting a fool, you think they're going to put the breast implants in?
Absolutely not.
No, they're going to call the cops and you're going to fucking go to jail.
Yeah. The expectations on emergency medicine is unrealistic. It is not okay. It's not okay. I mean, I will never in my life understand how people think it is. I mean, I'm not knocking cops or anything. I know
No.
their jobs are hard. I
Mhm.
know they have a lot going on. But let me ask you how, in your mind, when you bring us these crazy ass patients that you think we're going to take care of them, when your ass has the gun and
The
the
taser and the
pepper
pepper
spray and
spray
all
and all
that,
the backup.
but you're going to bring that to us.
Yeah. What's
And
he?
I'm not trying to be shitty to anybody, but half the time you either go to a hospital that has no security or the security that they do have is shit.
Yeah.
Oh, we can't touch them. We can't do it. We can't do it. Not our problem. Not our problem. What the fuck do you mean it's not your problem? Your security.
Yeah.
What's your fucking job exactly?
Yeah. Keep us safe.
Excuse my French, guys. I'm sorry. It's just
No.
it makes zero sense to me.
Or you.
You're gonna bring a irate patient who's threatened to whoop everybody's ass, and I have no means to protect myself, but it's okay. You want to let me get my ass whooped.
Mhm.
Not quite understanding that. There's a
Yeah.
disconnect there.
Yeah. I think there's a general lack of concern for staff safety when it comes to patients acting like that. So it's like, it turns into an argument of whose job is it? So take a psych patient that has been detained,
Okay.
right? So it's EOD'd. What is it in
It's a
Oklahoma?
EOD.
EOD in
Yeah.
Oklahoma too?
Yeah.
Okay. So emergency officer detainment. So this person has said, I'm going to kill myself or kill somebody else. The officer says, you are not safe to be in public. Before I take you to a psych facility, you got to get cleared by the hospital, which you need a psychiatrist, not an ER physician. And we don't have psych in our facility. You have them EOD'd, they come in, and then all they're required to do, PD, is, okay, I'll fill out your third party
Yeah.
affidavit if they know about it. I had personally one yell at me because I asked the question. Literally, the question was, why are you here today? And then the response was an irate yelling, I don't like your attitude, stood up like they were going to bow up on me. I got ready to fucking knock them out. And then they were like, I'm leaving. I was like, cool, see you later.
Yeah.
And then they leave. And then all of a sudden it's like, they were brought in by police. I'm like, where the fuck were the cops? What happened? Why? I wasn't told this. I don't know what it just said psyche about. Looked like they self-checked in.
Yeah.
I didn't see anything. I don't know anything. Nobody told me anything. The cops aren't here.
Well, I mean, if they're
they
not
want to leave,
admitting
they
to
want
it,
to
what do
leave.
you do?
And so then that becomes a thing of like, if they're detained and they want to leave, who are they detained by? Is it the cops that brought them in? Is it the facility that may or may not have checked them out yet and detained them? Is the hospital detaining them? So is our security force detaining them? And then you have this pissing match argument of, well, if they want to leave, they can leave. And we're like, no, they can't. They're suicidal.
Yeah.
They've got to stay here. And then you have your security going, we didn't detain him. Nobody told us. And so then they're just able to just like walk out, and we're like, all right, now we got to call the cops. Well, now they're under arrest, not just detained for a psyche eval. And then it turns into a whole other thing. Or they go beyond the max, hurt somebody, like actually reach out and hit or strike a nerve. And then how many times have we heard in the last couple of months, just in our nation alone?
Yeah.
We've had a shooting in a facility. We've had a tech get put in ICU.
Yeah.
And then multiple nurses be like mauled and beaten.
Yeah.
By psych patient. I mean, it's the holiday season, which also means for our work, psych season.
When is enough enough? That's my question. How many people is it going to take to get some kind of corrective action?
Yeah, because there's.
I mean, are you going to just continue to let it happen until you have no emergency room nurses?
Yeah, there's no accountability.
Is that the plan?
Yeah.
I mean, let them beat the fuck out of them, almost kill them, and then we'll take care of them. And then hopefully they might not be so traumatized by the situation that they might come back and fill that slot again.
Well, and then you get into the gray area of like hold them down and sedate them. And then it's like, oh, well, did you hold them hostage?
Yeah. I mean,
and so if they have a good attorney, well, now the hospital's sued,
well,
the nurse is sued.
as long as
the
they
nurse
have,
loses, they're not licensed.
As long as they have the EOD, you're covered because that is an emergency detainment. I mean, you have it. But still, again, you're risking all these people who are there to make your facility money,
Mhm.
but you're okay that they're getting the shit beat out of them. It's like, I'm not okay with that. I'm not okay with these behaviors coming in there. I mean, do I get everything I want? Absolutely not.
Mhm.
Grow up, Buttercup.
Yeah.
Suck it up.
Yeah.
It's bullshit.
I literally my own personal primary care physician is like, you have had enough surgeries and enough injuries that you either need to be one on marijuana or two on pain management. Which one do you want to be on? And I'm like, I still work for the state.
Yeah,
I can't.
you can't do it. I mean, you just can't.
And he's like, so you're willing to be in pain? I'm willing to write you a prescription for whatever you want. I'm like, man, you know what? I don't want that. I don't want to be addicted to it. I see it every day in my job,
Yeah,
and those people are not okay.
no, they're not. And, I mean, I get that. No, I don't get it. I really don't. I never will get it. I
Yeah,
mean, it's
I
just
don't
not something
understand the
that
inappropriate behavior.
it's just not something I'm okay with. I go to work and I try to do the very best job that I can. I will go overboard
Mhm.
taking care of my patients. Oh, you want this? Let me see what I can do.
Mhm.
I will bend over backwards to help them out. But if you're cross with me and you're shitty with me, I tried, you didn't want to, so let's just call this not a good relationship. And I'll still take care of you, but I'm not going to baby you like I would my other patients.
Yeah.
Because I do. I baby my patients. When I have them, if you want it, if I can get it, I'm going to do it.
Mhm.
If you're yelling at me, acting stupid, cussing me out, calling me names, threatening to hit me, I'm not going to go overboard for you. I'm going to
Well,
be
and
like,
so
you suck. I don't like you.
mhm.
I'll be back in an hour to at least look at your body and make sure you're still breathing.
Yeah.
That's about as good as you're going to get with me. Oh, you want a blanket? You might get that in an hour.
Well, and so for first responders, like pre-hospital, there is a priority index on safety. So it's your personal safety first. It's the safety of your crew second. It's the safety of the community third, and then the safety of the patient.
Which is probably
So
not a
it
bad
goes
thing.
in order one, two, three, four.
Mm-hmm.
I feel like in the hospital, it's like no, it's just a patient. We don't care about you.
Yeah.
It's like, what do you expect me? One, you sent me to some bullshit uh, hands-on training of how to deal with an angry patient,
Which
and it's
would not work.
literally stop, don't touch me there. This is my no square. Or let me stand aside and push you and not hurt you, bitch. No, I'm gonna hit you where it hurts the most.
Well, I sure the hell ain't going to stand there and let them beat me up.
Yeah,
I'm not
I'm
going to
either
do
going to
that.
run away and
Mm-hmm.
ask for help, and if they pursue me, I'm winning. They're not. They're already in the hospital. Congratulations, they're close to X-ray, CT, and surgery. It is not okay
It's not.
to one come in alert and oriented and act like a fool. I will never ever in my ever understand making it individually all the way to the ER and then not able to walk and not able to piss and shit without doing it on myself in the bed and
Yeah.
expecting somebody else to clean it up.
And I'm going to be honest with you. If you're capable of cleaning yourself up, you're going to.
Yeah.
Because I'm not
Here
doing that
is your
for you.
tissues. Wipe your own ass.
Yeah. I'm
Yeah.
not doing that for you. I'm just not.
That
Our
I don't
job
understand.
is not to be your servant.
No.
Believe it or not, I'm actually
Yeah.
educated. I went to college.
Yeah. I'm going to mitigate your emergency and then I'm going to send you home. That's what people don't understand. They feel like if they come to the ER, one, the other thing that pisses me off is that they come to the ER because they can't get into their primary care fast enough.
Okay.
That's a whole another topic.
It's a whole nother issue because number one, most of the time these people, no, let me rephrase. Some of the time, let me rephrase again. Occasionally, I don't know. I don't even know how to phrase that. You have those people who tried.
Absolutely.
And then they're redirected to the ER.
Yeah.
Okay. Not that the ER is never busy because all we do is, according to some people, we play with our doctor's stethoscopes and play cards behind the desk. So, that cuts into my card time. It pisses me off.
Yeah.
Anyway, that's what's happening is they're being redirected to the ER. It's overrunning the ER with shit that doesn't need to be there.
Yeah. Cough, cold, toe pain. I sneezed. Okay. Okay. And so now, because they're in there, it's our problem.
Yeah.
And it's not like I wish, part of me wishes that we had the form of universal health care that you can look at them and go, you're not having an emergency, go to your doctor.
I mean, I
And
don't
I
think it'd be a
wish
bad
that
thing.
was a thing here. If you're acting a fool and irate, nope, we are not seeing you. You come back when you're
You can act
safe. Yeah.
appropriately.
You know, granted, altered is different from I know what I'm doing.
And I'm going to be honest with you, drunk altered is not even okay.
It is not.
It's not okay because if you're able to fight me,
Mhm.
you need to take your ass on to jail for your DUI.
Yeah.
That's what you need
Yeah,
to do.
you go sober up and then come back.
And I wish that these cops would quit giving them the fucking option.
Mhm.
What the fuck is that? You can go with me or you're going to go to the hospital. Well, I'm going to go to the fucking hospital where I can act a fucking fool.
Yeah.
What the fuck?
Yeah.
Excuse me. I use that word a lot. Anyway,
it is okay.
it's not okay to do that shit, guys. It's not. It's
Yeah.
a public intox.
Mhm.
Take their asses to jail. Let them sober up.
Yeah, but you have really good attorneys that have come in and said, well, if you would have, and they've convinced a judge
And those
or a
attorneys can
Supreme
fuck off
Court,
too,
right?
because they're not the ones in there getting their
Yeah.
asses whooped every
Yeah,
shit.
come spend a 12-hour shift with me.
You want to come in there and defend people? Get
Mhm.
your ass in there and hang out with them while they're drunk and yelling at us and throwing shit at us and trying to piss on us.
Yeah.
What?
And then look at him and go, hey, you're up for room 17. They're pissed. Everybody else is busy. Go handle it.
Yeah. I'm like, why
Yeah.
don't we try this
They
out?
were
for a
within
little bit?
250 yards of our facility when they collapsed, and so now it's our emergency and it's your job.
Yeah. Come and hang out.
Yeah.
See how it really is.
Yeah.
I mean, you
And
know,
then tell me how hard you're going to fight for them in court. I am
Ugh.
sick and tired of seeing like medics get the shit kicked out of them.
well, any healthcare or
You know,
I mean, and I get
cops,
it. Cops,
you know,
it's same thing.
cops, same thing. Like all you have to have is a cell phone camera and edit it the correct way. And you don't see the perpetrator acting a fool while the cop was trying to do everything they could to mitigate the process and not get them arrested. But then it turned into an arrestable offense and the cop ends up getting their ass kicked.
Yeah.
And because they edited the video correctly, the cop is the evil one.
Oh yeah, 100%.
Not okay.
No, none of it's okay.
You know,
and I don't
God
know
forbid you're in the military and you shoot somebody that was acting aggressively, but it doesn't fit the rules of engagement. You know, because now you go to Leavenworth. You know, if you're a medic in the back of an ambulance that doesn't have a camera, all the patient has to do is say something. Well, guess what? Their complaint is taking over the guy that you hired to do the job.
Yeah.
You know, or a nurse. I don't know how many times I've had somebody go, well, he said he made me feel, and that was more valued than me going, yeah, that's not who I am. That's not what I do. And you know that because you know me personally.
Yeah. I just think that I don't even think I have a real opinion about it. I really don't, other than the fact that it's not okay.
Yeah,
It's
generally
just not okay.
speaking, don't be a dumbass when you come into the hospital. Don't expect, demand, do anything. You the way I look at it, if I go into an ER, I am a guest in someone else's house.
Yeah, I go out front, I sit there until I'm welcomed back.
Yeah. And I realize I'm not the only one with an emergency today.
Yeah. I mean, and guys, when you come to the ER, it's not a 15-minute visit. It's not a doctor's office.
No, what it's still 4 hours door to door is the routine visit for nationwide. Nationwide, 4 hours door to door for a general company. That's if you come in for a cough, you're going to be there for 4 hours. If you say chest pain, hello, 8 hours.
Yeah, it's going to be a visit,
especially
and
if
your
anything is off.
Yeah, and your expectations can't be. Why is this taking so long? Well, let's see. You had chest pain. Yeah. Now we're having to do all the labs.
Yeah,
and then we're having to do some of the repeats on the labs. So guess what? That takes hours.
Oh, here's the other thing that jacks with me is Well, I've had this pain for a couple of days, and so I took a shower this morning. It didn't go away. So I went to Brahms. It didn't go away. And so they show up, showered, smelling fresh, looking good with their Brahm, but they're having a life-threatening emergency. And then it ends up becoming the person that's like, can I get a blanket? Can I get a sandwich? Bitch, you just ate a double cheeseburger. While you were telling me that you were having chest pain. What the fuck? And then you're like, I need a blanket. I need another blanket. Can my friends come back? Why can't all my family come back?
Yeah.
Why can't this? Why can't that? Hey,
I'm
I
just
need to
going to
go
throw
to the
out there,
bathroom.
COVID had its perks.
Yeah.
I'm
Yeah.
sorry. I know that's rude. I mean, I've had patients come in, be perfect angels, be the best, sweetest person ever.
Mm-hmm.
And of course, yes, I went and got their warm blanket and did all the things.
Yeah.
And then all of a sudden, a family member comes in and it's like, why have they been laying back here for the last 3 hours in pain? Well, let's see. For the last 3 hours, I have been in that room no less than 7 times. And every time I went in there, are you feeling okay? Are you hurting? Do you need anything? And the answer was always miraculously no. But now, 3 hours later, since your ass came in here, all of a sudden we're in 10 out of 10 pain. I'm confused. Are you want me to give you the medications or the family member who had no pain for 3 hours?
What's even more fun is when the nursing home patient shows up and then the family member that's on the piece of paper at the nursing home gets notified. They haven't been to that fucking nursing home in 3 years. But now that they're in the hospital, all of a sudden shit better get done.
Yes.
Shit better get done. And what makes it even more fun is when the patient in the room says, I haven't seen my son in 3 years.
Yep.
And he's the one that's like, get this, get that. Why aren't they here? Why aren't they that? They needed this, they needed that. And I'm like, how do you fucking know them? From your own father, I know that you haven't seen him in 3 years, and you're on paper with them going, I haven't been able to contact you in 3 years. Why do you care now? You haven't cared for 3 years. Let me tell you something. Fuck off. But I can't say that because Press Ganey says that I've got to have an 8 out of 10 and they've got to fill out a positive card and give me a fucking flower award. I'd rather have the black rose. Or they come in and they don't know shit about them, but they demand everything.
Yeah. Oh, I like the ones that you get that they come in. They're like, how long have they been like this? Well, let's see. They've been in my ER for 30 minutes. I don't know.
Yeah.
You tell me, is this their normal or is this not their normal?
Yeah. When's the last time you saw me, Mom?
I mean, oh, it was 2 years ago. I mean, all I can tell you is what I see here.
Yeah. Because what's been worse, like for me in my position, it's typically the family member is worse. I don't get like they're typically still kind of nice to me because they check in and they say the magical complaint that means that we've got to see them within seconds.
Yeah. So,
and so I'm like, all right. And then what changes everything is when I say the magical word of, hey, we're full, we don't have a room. So I'm going to do your triage. I'm going to put you back up front. If anything changes, let us know. We're going to keep an eye on you. Just because you're out in the waiting room doesn't mean we can't treat you. We can still get your labs.
Yeah, we can
do your things. Imaging, do all the things. I just don't have a room to put you in.
Yeah.
Well, what if I die out front? Well, you're in an ER and you're pretty close, and we'll work you out there, but we don't have a room.
Yeah.
And then they look at you like, are you serious? I get my favorite thing out of that was I've never had to wait in the ER before. And I'm like, well, sir, you've never been in an ER before because all of them you're having to wait in.
Yeah, I mean, typically.
Well, I've never had to wait here.
I mean,
yeah.
An ER is an ER. Don't expect fast visits.
Yeah.
It's also not going to happen.
Your emergency doesn't manifest a room.
No.
I can't go, oh, you're here for chest pain? Let me go build another room right quick. Give me 2 seconds.
Yeah. It just, I don't know.
Yeah.
It's just the expectations is the worst part about it. And HCAP scores, I'm sorry for admin people who are listening, they're bullshit.
Yeah.
They're bullshit.
Yeah.
I mean, if you want me
what
to go
is the
in
role in the mission of the ER? It is simple. It is a one-line statement. Mitigate the emergency process.
Yes.
And as soon as that is done, hey, guess what? Go to your surgeon, go to your specialty, go to your primary care, go get it done. Your emergency is done. You are no longer actively, immediately dying.
Yeah.
Bye.
Yes. And we're done with you. And We pray to God we don't see you again.
Yeah.
And that's the sad thing about it.
Yeah.
But no, instead, well, please come back as soon as possible because I want to take care of you again.
Yeah. Oh, another topic is providers going, hey, if you're not better in 2 days, check back into the ER.
Quit.
Okay, it's not a clinic.
No.
If they're having an emergency in 2 days, please tell them if you're continuing to have an emergency, step in. But if your toe pain is not magically relieved by the 3 hydrocodone that I gave you, and you failed to check in with your primary care or pain management that you already have, don't fucking come back to the ER for another 3 hydrocodone that another provider is going to have to provide.
Yes.
You know how many times I've seen the provider go, who the fuck told them to check back in? And I'm like, I don't know. I'm not allowed to see that part while I'm up there giving you the message of who's checking in. Or what's even more fun is I had a surgery at another facility, but they told me to come to the ER and I'm here now.
Don't do that.
And I'm like, shit.
Just for general public. Yeah. If you had a surgery at point A and they tell you to go to the ER, do not go to point B. Go straight back to point A unless you're dying.
Yeah, where that surgeon is at.
If you are dead, come to point B.
Yeah.
If you are not dead and you're going to make it to point A, go to point A. Because guess what? No surgeon is going to touch some other surgeon's work. They're not going to do it because they don't want their name attached to it. Because if something went wrong and they try to fix it and something goes wrong again, they're going to look like shit. So guess what? Surgeons will not touch other surgeons' work.
Absolutely.
Sorry. Sucks to be you. But they will not. So not only are you getting 1 ER visit charge, not that you'll probably pay it anyway. It doesn't matter. You're going to get sent to another ER where you're going to get another ER bill.
So you're going to EMS or a flight bill, another ER bill, that surgeon's bill again.
Yes.
And the ER that you went to that you shouldn't have gone to in the first place.
Yes. So you're going to get all these bills for what you could have just done is go straight back to the ER or to the hospital that did your surgery.
Oh, you know how many times somebody's been pissed off at me because I went, did you call the surgeon that did the surgery? Well, no. Why not? Like, well, it's hurting and I came here. Hey, if we take a look at you, guess what our surgeon is going to do? Hey, call the surgeon that did the surgery and go there.
Yeah. I mean, if it's like you're dying, come to the ER, go to point B.
Yeah, I'm having a PE. I can't breathe. You should be coming in by ambulance, not POV.
Yes. I mean, if you're capable of getting in a vehicle, life is not over.
Yeah.
You're breathing, you're doing the things,
mm-hmm.
Go to the other hospital.
Yeah.
Oh, you didn't want to drive an hour? Well, you know what? You just spent 4 hours in my hospital. You're still going to drive an hour. And
you're going to spend 4 hours on another one before the surgeon ever looks at you.
Yes. And then if they don't deem you dead, you might get discharged.
Before you even see the surgeon.
And guess what? Then you don't even have a vehicle to make it home in.
Yeah.
Unless you were lucky and had family that wanted to go and hang out with you. It's like, come on. Critical think, guys. Critical think.
Yeah.
Well, it's not even critical thinking. It's just think about it. Just
my other ick of coming to facilities that I feel like is inappropriate behavior. Don't bring your kids to a place that doesn't have pediatric options.
Yes. Right. If you're closer to another facility, don't drive 45 minutes to a facility that doesn't offer pediatrics.
Yeah.
Don't do that.
Yeah. So if you live in a rural setting, know that you have rural hospitals and they have very limited capabilities. Please, 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 while you're Googling your signs and symptoms that tell you have a life-threatening disease and get to the ER immediately, Google that ER and figure out what options they have.
Yeah, and most of the time you're probably already going to know because you probably go to the ER so much that they know you by name.
Yeah.
Oh, that was so tacky. Quit. It's just, I don't know. I will never in my life understand.
But the people who like piss in the floor, crap in the bed, that are capable, the people who throw a fit. I don't know how many times I've had at least once where somebody drunk looked at me and said, "You're not big enough." Right.
And guys, what just for the general public, I mean, if you hit a healthcare worker while they're in their facility, that is a felony.
Mm-hmm.
So for you drunk people who like to come to the ER and act stupid, you hit somebody, you're gonna end up with a felony charge.
Yeah.
And you nurses who are not following through with that, you need to start doing that. Because eventually, hopefully, one day, people will actually figure out that, oh, I can't go beat up my healthcare worker because I'm drunk and acting
Well, and
stupid.
yeah, and if
You
you're the
know?
nurse that has been assaulted by somebody and you don't do it, all you're doing is letting the next healthcare person be assaulted.
Yeah.
And so, absolutely, maybe nothing will come from it. So, I get it. I've heard nursing staff say, I'm not going to file the complaint or the charge because nothing will happen. Sure, fine. The only thing that saves you and saves the other person is if there's a paper trail.
Yeah.
And so, if nothing happens for yours, I'm sorry, that's inappropriate. Contact your nurse association or your state and let them know that nothing happened, even though you were assaulted and there is a paper trail. Do both of those things to prevent the next staff member, EMS person, police officer, hell, family member from being assaulted.
I guarantee you ever find my ER, you end up in there with me and you hit me, your ass is going to jail. That's
Yeah.
all I'm saying.
Yeah.
Because I ain't playing with none of you.
So when you do come to the ER, please realize that your emergency is not the only one. If you live in rural podunk like we do, know that your ERs at a max, what, have 15 rooms? That's a big ER and
for rural areas. Yeah,
I've
definitely.
been to some of them that have 3 and 4 rooms.
Yeah,
And
I think I've worked in a few of them.
Yeah,
so,
it takes one patient to derail everything.
Oh, it does.
And make it to where no one else can come back. And yeah, you have a community of 4, 5, 600 people and a 4 to 11, 12, 13 bed ER. You're not the only one showing up.
No, no, they're pretty popular actually.
Yeah. And if there's no ERs around you because they've closed, like is happening, that's just know that it's not just your community, it's the surrounding.
Yeah, I mean it's
rural areas,
they cover
counties,
large areas.
Yeah,
really
ours is huge.
Yeah, I mean, and
like we're overwhelmed when our ER is empty. I get the ability for the amount of people to come at any given notice.
Yeah, I mean, we could be empty and then 5 minutes later be completely full.
Oh, with 10 in the waiting room.
Yeah, I mean, it happens. I mean, your night starts out great. You're like, shit, we're going to have a good night. And then by 9 o'clock, it's like, what the fuck just happened?
Yeah, there's 30 people that are looking for help and you can only help 5 of them.
Yeah, it's like, okay, I guess I pissed off the
and
ER
every single one of them has a legitimate complaint.
Yeah.
And then guess who comes back? The ones that are acting a fool.
Yeah. And you're like, okay, what did I do to deserve this?
Yeah.
I thought I was a good person today.
So hey, be nice to your police, fire, EMS people, your helicopter people, especially your helicopter people have good drugs and liberal protocols. So if you want to find yourself in a bad way quick and piss them off.
Guys, just the biggest thing. Don't act like a damn fool. I'm like, just remember the way you want to be treated is the way you need to treat other people. It's just that simple.
Best thing said right there.
I mean, if you want me to treat you like shit, come on in and treat me like shit because I'm not going to treat you any better. I promise you. You start talking crazy to me, I'll probably talk crazy back because that's just me. And
for unhinged essentials, don't go unhinged on them, but also protect yourself and stand up for yourself. If you're being put in an unsafe situation, don't allow it. Call your supervisors, call your staff. If they're not going to come, start pestering them because the squeaky wheel gets the grease.
Yeah.
And they'll show up eventually. If they're not going to show up, call law enforcement, call security, make sure that your safety and your staff safety, however it is, crew, whatever, is paramount. I hate assholes.
Yes.
I hate having to pretend to be nice to them.
Just guys, put on that fake smile. Everybody can do it.
Mm-hmm. Well, that's it for another episode of Cuss and Discuss. Thank you for listening to our re-recording. This was fun. We know this is a hot topic. If you have any feedback, let us know. Let us know how your facility or your organization handles the special people. Again, we're still in the month of November. We're entering the holiday seasons. Let us know your traditions. Let us know your recipes because we likes the foods.
We love the foods.
Typically, food helps me when I deal with the angry ones.
Honestly,
like
eating your feelings,
pizza.
Eating your feelings is perfectly fine.
Yeah.
It's okay. All right, it's okay.
For our guys in our outlying countries, let us know where you're at, how you're doing, and how your facility handles stuff. For you guys in the great old US of A, we love you. Stay safe, stay vigilant, stay feral. Hugs and cuddles.
Kisses.